And it is my great pleasure to invite our second speaker, Dr. Pranita Sahay. She is, once you get to her degrees, you will be suitably impressed. And she is very actively involved in teaching, especially postgraduate education. And she will be talking about ICO examinations, FAICO, subspecialty fellowship examinations, and really are they necessary and how do you proceed from there?
Hi, good morning everybody. I'm Dr. Pranita Sahay. So I'll be discussing about FICO, FAICO and FICO subspecialty exams. So once you crack your postgraduate entrance exams, you're all happy and elated and you feel, wow, that's it. But once you start doing your post-graduation within a couple of months or in a year, you realize that's not the end. You need to do something more that's going to add to your CV because post-graduation is something that everybody is going through. So that is what you need to think and plan in advance so that you give the right exam at the right time and don't waste your time, effort, and money as Dr. Devendra was rightly telling about. So whether you want to study abroad, you want to practice in India, you want to go for a comprehensive ophthalmology practice, or you want to go for a subspecialty specific practice in ophthalmology is what you need to decide, and on the basis of that, you choose the exam that you want to give. So if you want to go abroad and study abroad, there are certain fellowship certification courses that you can take up and clear these exams so that your fellowships or certification courses or work outside becomes easy. So the various international bodies that conduct examinations are the International Council of Ophthalmology, the Royal College of Surgeons, which is Glasgow, Edinburgh and Ireland, and the Royal College of Ophthalmologists, which is the FRC of the examination. So first I'll be talking about the ICO exams. So the ICO conducts two types of exams. One is the ICO, which gives you an FICO degree, and the other is the FICO subspecialty exam. So the FICO itself has 3 steps. Okay, so the step 1 has 2 parts, which is part A, basic science, and part B is optics refraction. The step 2, which is clinical ophthalmology, and the step 3 is advanced examinations. Once you clear all these 3 steps, then you get your FICO degree. Subspecialty is something that we'll deal separately. So what do you deal with in your part A? Part A deals basically with your anatomy, physiology, and biochemistry. Okay. In addition to that, you also have to have a background knowledge of neuroanatomy, epidemiology and stats, path and micro, genetics and biochemistry. That means you need your basic MBBS knowledge in addition to your anatomy, physiology of ophthalmology. It's an MCQ based exam. There's no negative marking, 120 standard MCQ questions. And the books that you need to read is the book given by John Ferris is something which is very helpful to clear this part. So it basically helps you with all these various subsets that I talked about. And in addition to that, the AAO series and the anatomy and physiology book by Dr. Khurana is also very helpful. Now, part B deals with optics and refraction and instruments, which is again an MCQ based exam, unlike the FRC OPT, wherein for refraction you have a practical step. This is only an MCQ based exam. For this, again, Elkington, the Chua's Optics MCQs are helpful, Duke Elder, and Optics and Refraction book by Dr. Khurana can be read for it. For clinical ophthalmology step, you need a comprehensive knowledge, a holistic knowledge of the entire subject of ophthalmology. So you need to know all the specific subspecialties well, and in addition to it, general medicine related to ophthalmology, community and public health, and ophthalmic pathology and tumors is also something which you need to know in addition to your comprehensive ophthalmology. Again, it's an MCQ-based question paper with 115 questions, no negative marking. Kansky, American Academy of Ophthalmology, is the basic that you need to go through for clearing this step. In advanced examination, again, in addition to your holistic knowledge of ophthalmology, these questions in this step are not basically theoretical, but also check your clinical application to case-based scenarios. So you need to have a comprehensive knowledge again, like you're preparing for your MD Viva. So MD or MS Viva when you're giving your final exams. Once you're done with your MD or MS exam, that is the right time to write this advanced examination because you'll have a better knowledge by that time. In these, other than the MCQ, also have extended matching questions, and there's no negative marking in this step as well. Now, when to appear for these ICO exams? Now, since we discussed that the Part A and Part B are the basic sciences and optics, the beginning of your residency is the best time to start these exams because you have your additional MBBS knowledge fresh with you, and you don't need to put in a lot of effort to go back to the neuroanatomy and statistics and all that is part of this exam. Optics, the right time I would suggest would be by the end of your first year of post-graduation, because by that time you have started doing refractions, you know the basics of optics and refraction by that time. Clinical ophthalmology and advanced exams step right would be once you are done with your PG. I know a lot of you may be already in your second and third year, but it's never too late to start. You can still start writing the exams. For subspecialty, the eligibility criteria is a separate, we'll discuss. Coming to the examination fees, if we look at a total of 3 steps, it costs a minimum of 1.5 lakh. So you need to plan well in advance and write the step only when you're well prepared because you don't want to go through an unnecessary financial loss. Now there are certain additional benefits of appearing for these exams. Once you clear your part 1, that is step 1, which is your both part A and B, it gives you an exemption from FRCS Glasgow step 1. And once you have cleared the clinical ophthalmology part as well, it gives you an exemption from the FRCS Glasgow step 2 as well. So you can directly appear into your final step of FRCS Glasgow, which is your practical exams. Now the other advantages, as we all know, we can use a post-nominal acronym with FICO added to your existing degrees. It also gives you opportunities for international short-term and long-term fellowships, which are advertised on the ICO websites from every 6 months. They are advertised, and you have 3 months or 2-year fellowships, which you can avail after applying through those websites. They also give scholarships and grants every year, and for which you become eligible once you clear the FICO exam. So that was all about the FICO exam. Now we'll move on to the subspecialty exam. So why is it necessary to give a subspecialty exam? We all know that in India, the MCH courses are very limited. We have only one institute running MCH course in retina and cornea only. So if you actually want to go into a subspecialty practice, you go for a fellowship. But fellowship does not give you an additional degree. When you clear your FICO or FAICO with a subspecialty degree, specialty course, it gives you an additional degree which you add on to your current affiliation. So nobody questions you, neither a senior, junior, or a patient is going to question you whether you're a cornea specialist or a retina specialist. You have that added to your affiliation. So that is why I feel it was important, and hence I wrote the ICO subspecialty exam. So it needs at least 1 year of experience in the chosen topic in which you want to appear. The various subjects in which ICO gives you a subspecialty exam is the cornea and external eye disease, glaucoma, retina, oculoplasty, neuro-ophthalmology, strabismus, uveitis, and cataract. As it is also an MCQ-based question, so it is relatively easy to write this exam compared to FAICO, where you also have an additional practical step. This is only an MCQ-based exam. Also, there's no negative marking. American Academy, Kansky, these are the basics that you need to read. But in addition to that, obviously, you need to be aware of the recent advances in that specific subspecialty. Now, AIOS also thought about it, and they came up with the FAICO exam. In addition to the ICO, we have an indigenous exam, which gives you a certification to be a subspecialist. The eligibility criteria remains the same. You have to have a 1-year experience in the chosen topic. The subjects which it offers in addition to the ICO is refractive surgery and comprehensive ophthalmology, in addition to what FICO was offering. Again, this is an 80 question-based MCQ with no negative marking. But the additional step, as I told, you have a practical examination which you need to clear. The passing rate for FAICO, unfortunately, is very poor, is just 30 to 40% every year. So you need to really prepare well, because the failure rate in practical exams is quite high. Okay. So basically, to decode the dilemma, if you're looking just at an international fellowship post your PG, you want to go for a 3-month or a 2-year course outside, ICO is the exam that you're looking forward because it can give you scholarships and it can give you fellowships outside. But if you want to go for a specialty practice, say here in India itself, I would say go for FICO or FAICO subspecialty exam. However, if you want to plan to settle outside, FRCS Glasgow or FRC OFT is what is going to help you in future. So plan well in advance and take a note of the ideal time to appear so that you don't have to duplicate your efforts and not waste your money and energy. So basically, I'd like to end this quote, and both me and my husband are going to end the quote on this note, is successful people never stop learning, keep learning and educating yourself. Thank you. So basically, the study buddy that Dr. Devendra was talking about is here, my co-instructor, Dr. Devish. We were study buddies to write all these exams together. Okay, thank you.
Thanks, Dr. Pranita. So, pick your study buddy wisely, almost as important as your spouse. I invite Dr.